breaking a lot of myths, and I hope I can do justice to such a complex, not a difficult, complex topic. Okay.
Good, af- Good afternoon, ma'am.
Yes, ma'am. Good afternoon. So this was something very earlier. So let me tell you this: the earlier, team assistants had put this. Please do not ask personal questions because we cannot answer the same without complete understanding of your own case. And there are many questions that each participant has. So we request you to limit your questions to the relative topic of the session and not indulge in questions regarding family members' personal situation. वो सब हम नहीं करेंगे. Okay. Yes. So this again is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness as well as disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize those symptoms, and then how to go about getting the right kind of treatment. What is the meaning of this atom bomb slide is that we had learned in school a stitch in time saves nine, right? So similar to this, if I pick up my illness, my disorder, my disease, see the various terminologies I'm using. In fact, something known as an indisposition. What is an indisposition? Something which I've eaten wrong and I'm puking or I'm having diarrhea and I correct my food and it's gone. So that's not a disease, it's not a disorder, it's not an illness, it's an indisposition. So understanding that, differentiating between all this and picking it up in the first stage means I can nip it in the bud stage. I do not allow it to catastrophize and become like a snowball effect when it becomes the last stage of the disease and the doctor tells me, look, you come too late. Okay. So these camps are for your awareness. They are fun camps. I try and make them very, very lucid, very, very clear and fun so that this medical terminology is understood by layman also. I try my best. And I too enjoy taking these camps along with you all, as Carol said. But we must resist the temptation of self-diagnosis, self-medication, even self-treatment, even self-management. Please, please consult a doctor. Maybe the doctor sends you to an MD doctor. Maybe the MD sends you to a DM doctor. Okay? Why I'm talking of all this is because today's topic is a very heavy topic, diabetes, and we go to the general practitioner who is just an MBBS. He starts with medicine. He is not trained. Let me tell you, he's not trained at all. In fact, even the endocrinologist, what is the endocrinology is the highest degree in medicine, because what they do is they do MBBS, then they do 2 years of internal medicine, and then after that they do, that is MD, then they do DM. They specialize in hormones, in prolactin, in insulin, in just about leptin, every hormone they specialize in. So it's a good idea to pay that consultation and visit an endocrinologist and not just a general practitioner, because you can be doing your body harm. Okay? Don't try to save a penny out there. You can be doing your body harm. They are trained. So in fact, the endocrinologist, she was telling, I was just listening to her. She said that she was not trained in reversal of diabetes. So I have just done a diabetic educator program. It's a government program. She also had to do that diabetic educator program later on. And after that, she realized that if she's writing something and giving to patients, they are not listening to her. They're not able to follow that mindful eating or, restrict your carbs. Then again, she did a course on what? She did a course on mindful eating to understand that. Then and after that, again, she understood, but I'm not able to manage the stress levels of people. So she did a course on Reiki and stress management. Okay. And then we wonder, why should we pay a doctor 2-3 thousand? Okay. After that, she realized people are coming and asking me a lot of questions about gym training. So she did the gym trainer course also. Okay. Isn't it beautiful? Hmm? So understand that everybody is trained. Can we repair our car ourselves? No, we have to go to the garage. So if the car is maybe 12 lakhs, 15 lakhs, we take so much care of it. How can we visit an MBBS doctor and take his prescription for my hormones? Clear? So allow this. These scams are just for your medical awareness. Don't take the things in your own hands. Okay, let's proceed further. We will be understanding that the etiology. What's the meaning of etiology of diabetes? The causative factor of diabetes. Okay. And we will be understanding that many of us use this word. I have high blood sugar. That means I have diabetes. That is something very, very erroneous, very, very wrong. We should be understanding that high blood sugar is a symptom of diabetes. Okay, everybody repeat this word in your mind. Symptom. High blood sugar is a symptom or a sequelae of diabetes, which happens after diabetes. Okay. We will also be understanding the concept of insulin resistance, which is the basis of diabetes. Okay. And my dear friends, let me tell you all that you may think that diabetes resistance is just Anjali Saraswat, welcome, newcomer. So diabetes and insulin resistance, just these two things are. Hello, Dilip sir. Nice to have your camera on. Welcome. But do you know that girls with PCOD, with PCOS, polycystic ovarian syndrome, polycystic ovarian disease, these girls also have insulin resistance. And unless you work on insulin resistance, you cannot reverse your diabetes, you cannot reverse your obesity, you can't reverse your hypertension. Okay. What is hypertension? Increased blood pressure. And do you know what is the main cause of heart attacks? Do you think it is cholesterol? So the main cause of heart
Yes.
attacks.
High blood pressure.
Yes.
Okay, go deeper. That's again a sequelae. So the cause of heart attacks also is insulin resistance. Okay. So my body cannot manage the sugar spikes. What do you mean by sugar spikes? We will learn a lot about GI of foods, the glycemic index. Ramesh Puri, newcomer, welcome. So we will learn towards the latter part of today's class or tomorrow's 3 p.m. class. I will teach you about glycemic index, how to study it also. But understand that these sugar spikes, my body cannot manage, and these cause even heart attacks. So it's very important, very important. So what you do is you take medicines for it, but you are using medicine to treat food. Such a deep line. I'm taking medicines to treat food. Okay. You all will understand the statement why I'm saying this. Okay. And we will be understanding the role of diet and exercise in diabetes management. Okay, let's get started. So, what did you consume for breakfast today? So keep it in mind. Okay, we will not share what you consumed for breakfast today. Keep it in mind. And what do you think is good? Smoothies or milk? The cup of tea or coffee in the morning? And what do you think is good? This is a little bit of prior knowledge check, just testing your. What do you think? Walking? Everybody tells you diabetics walk. So what is important? Walking or anti-gravity exercises? So these questions will be answered tomorrow by 4 p.m. All of you all will be having the confident answers between smoothies or milk, walking or anti-gravity exercises, and what should be consumed for breakfast and what should be consumed for food. Now, a little bit about diet for diabetes. We will be understanding the importance of protein breakfast, elimination of carbohydrates to prevent sugar rise. Okay. So everything consists of three things. Food is classified into three sections. So either it can be a carbohydrate, it can be a protein, or it can be a fat. Clear? So simple, three things. We will be understanding and learning to differentiate foods according to their glycemic indexes. Okay, now let us understand one thing. Okay, so there is a lot of confusion. What should I eat? What should I not eat? And you know this slide, okay? This slide is really depressing because when somebody in the family gets diabetes, okay, what do the other family members feel? They feel guilty. They also stop eating the mangoes, or they don't eat anything sugary in front of the person suffering from diabetes because he may also get a little bit of a craving. So there are a lot of myths which have to be broken, and in the due course of an hour, we will be breaking them. So what is typical is this man has a lot of, what is this? What's this called?
Belly fat.
Fat belly.
Or it's also called Madhya Pradesh, or it's also called truncal obesity. What is the meaning of truncal obesity? The weight is accumulated at the belly. Right, Karen. So, now, waist measurement, I will be teaching you how to measure so that you consider yourself at the risk of diabetes. So the Centers for Disease Control and Prevention warns that exceeding the following waist circumference can increase the risk of developing obesity-related conditions. What do you mean by obesity-related conditions? Again, truncal obesity is the mother of all diseases. So suppose you have truncal obesity and you don't have diabetes, you will definitely have other metabolic disorders. What are the other metabolic disorders? Blood pressure, high blood pressure. Everything is related to that truncal obesity. So this is the way, these are the, in case you want to take a screenshot. For men, the waist circumference should be below 40 inches. And for non-pregnant women, I'm specifying out here, non-pregnant women, it should be a little below 35 inches. If it is within this range, the circumference, I will teach you how to measure it also. That means you do not have a risk of developing metabolic disorders. Okay, your waist should be measuring this. Now, how do you think we measure this? Okay, I'll come to this slide later. So you have to stand up straight and exhale. You do not need to bloat your stomach. And you have to wrap a tape measure just above your hip bones. What do you mean by hip bones? Okay, hold the tape measure flat against the body, not too tight, and take a reading. So first of all, you cannot be doing it seated. You need to stand and exhale. Whatever breath is there, get that breath off. Wrap a tail measure just above your hip bones. Now, here what I need to explain to you is, we think that waist circumference, okay, the slide is showing you waist circumference means the place where I wear my pant, right? The place where I wear my churidar or my plazo, okay, that elastic, that is not your waist in medical language. It must be your waist which your tailor takes. Okay, so now we all have hip bones. The hip bone is huge. We are sitting also on the hip bone, but the top portion is 4 inches above the panty or your underwear elastic. 4 inches above that, if you measure on your sides, there are 2 bony prominences. Those are known as your hip bones. Followed, Spandana madam? Where are your hip bones? Feel those bony prominences. You will feel them, and they may pain also. Mind pain. Okay, so that is the place you have to measure yourself with an inch tape. If it's more than 35, you're Madhya Pradesh, you are prone or susceptible to metabolic disorders. Is it very clear? Clear? Men, 40 inches. Simple. Huh? Don't measure at the navel region. Don't measure at the pant where you wear it high up, high waist. Not there. This is the way how you measure. Newcomers, Anjali Saraswat, Mehta madam, if you do not follow, I do not mute anybody because we are all responsible adults. I know you will not disturb me. Meena Kanvinde, if you don't follow, ask me. But I believe I'm very clear and crisp in my explanations. I go fast, but I repeat a lot. So you can unmute and ask. Okay, I believe in freedom of democracy.
Madam, please we take a screenshot of that measurement.
Yes, yes. Pratibha Shinde, are you teach me, Dr. Pratibha Shinde, please teach me.
नहीं
Dr. Pratibha Shinde wants to take a screenshot. I am getting scared of you.
नहीं वैसे नहीं है वो 2 बार दिखाया था.
Yeah, take it again. Please take whatever you
Okay,
want, whatever you want to
thank you.
circulate. I do not believe anybody can steal my knowledge. It's you will benefit from me. You will give me blessings. Okay,
Okay,
clear?
thank you. Thank you. Okay, clear.
Okay, next. Now I want to show you this slide. This, before we start anything. So this is the best slide. That knowledge is power, information is ammunition, and awareness is enlightenment. That is my best slide. Because if you have knowledge, then only you'll be able to manage your disease. Now, what is how mind helps in the management of, I have not written diabetes, of any disease. How your mind helps. So medication management. Now see, there are four wheels of a car. Okay. Now suppose you punctured one car, you'll pull on not even for half a kilometer, duck, your car will stop. Okay. Suppose you want to drag something urgent, you will go on. But it is very important to be having good air in all the four wheels of your car. So let us study the four wheels of a car. So one is sleep. Very important to follow your circadian rhythm. Circadian rhythm. What is the meaning of that? I can be eating the best of organic foods. I can be eating the best of foods. So now, have you seen some great CEOs? Okay, multinational companies. Okay, the best food. They exercise also very well, and suddenly they are running and they collapse and it's fatal. Why? Best food, best everything, best spa, best massages. Lack of sleep, too much work. I'm not talking of that girl, that CA girl. I'm not talking of that. That is something very different. Please don't consider this. Because we can't be spoiling an institution's name. If ENY is they are blaming, then there are 26-year-olds who are blank flats. Then do you say ENY has given me an international holiday? No. It's a different story altogether. So circadian rhythm means like on Sunday, we slept at 10 o'clock. Okay. And in the morning, nice 5, I was awake. I could do whatever I wanted. And 6, we went for a walk. So I was just telling my husband, 1 hour we slept early. And what it does to you. What it does to you. It's may sound 10 is too early, but it's up to you to create something in your life that you can sleep early and see the difference of the quality of sleep. Because between 10 and 2, your what is secreted? What is secreted? The sleep hormone.
Melatonin.
Meaning ho gaya, melatonin is secreted between 10 and 2. And that time, the body repairs itself. The body repairs itself with the help. The growth hormone is also secreted during that time. And growth hormone comes and repairs all your cells. Right, Dr. Pratibha Shinde? Okay, let's move further. So one is the sleep following the circadian rhythm. Following circadian rhythm means doing everything with nature. Okay, in time with nature. Not eating after sundown. Nutrition. Okay, paying attention to your nutrition. It's also known as TRE, that is time restricted eating. Don't be eating the whole day. I'll explain to you, which diabetics always say, 2 ghante mein khana. No. Now, then there's this great thing of exercise. Tomorrow, I will also be speaking about the dump exercise, the nitric oxide dump exercise, which is a sure shot winner for diabetics if done twice a day. And I will be explaining to you how it's done. I will not teach you because this is not an exercise class. So the third wheel is exercise, which is very important. Why? Come on, Mini Gogya, the 3 one-liners, which I always say, Dr. Dilip sir will not know. There are newcomers. The 3 lines about exercise. Come on, Mini madam. Neeru madam is not there.
Motion is lotion. I said I did not.
Motion is
Motion is
lotion.
lotion.
Movement
Movement
is
is
medicine.
movement is medicine, and
When
Genetic
body
mind
moves, body
organ.
grooves. The mind grooves.
yes, you all are all awake. Nobody's sleeping. When the body moves, the mind grooves. The mind dances when your body is moving because those endorphins, the feel good
तूने
hormones, are
45
secreted.
बोला है ना
Right, right.
अभी तो आवाज निकाली है
Chal, mute yourself, Neeru madam. Okay. In case you don't know any exercise, like I'm not a great fan of exercise. I have to cajole myself. And I tell my husband, it's because you're getting up, I'm coming. Now he's traveling next week, so I know I'm going to sleep. I'll not go. So in case you are like Dr. Divya Sitlani, what are you going to do? So what I do is whenever the bell rings, no, there's a huge fight in the house. No, kaun darwaza kholega? It's your person. It's your person. Like we've just eradicated the landline. Landline we don't have only. Why? जिसका जिसका मोबाइल है उस पे फोन करो. Okay? एक और झगड़ा कम हो गया. So like that, I always tell myself, no, get up. Get up. This is neat for me. What is neat? Although it is there, the daughter's ka something is there. And what is this? What is neat, Gurvinder Kaur? भूल गया, madam? Non-exercise activity.
Activity thermogenesis.
Thermogenesis. Neeru madam has written it down.
Yes.
Non-exercise. So I'm not exercising. So I park the car a little ahead. If I can go to the other, no, I will walk it down. Non-exercise activity, thermogenesis. So anything you're doing in the house also is an exercise. It is an burning of the calories. What's your Anaita ma'am? Are you awake?
Yes, ma'am. Awake,
Yes.
wide awake.
Wide awake, no? So now this wheel is the most important. What is this? It's telling you stress also, it's telling you spirituality also. Why both it's telling you is because suppose I name this wheel as spirituality, maybe chanting. Suppose I name this as knowledge. Suppose I name this wheel as patient education. Suppose I name this wheel as awareness. Okay. With this wheel, I can consciously do the right kind of exercises because I have limited time. I can consciously sleep well because my melatonin is coming. And I can consciously be aware of my nutrition. Clear? So this wheel, the fourth wheel, is the most important in any kind of diet, in any kind of disease management. Do you all agree? Now today you all have come for the class. What? For awareness, no? All of you all may not be diabetics. Clear? So this wheel is very important. This we finished. Okay. Now, this is the little bit of an anatomical introduction of your pancreas. These are the alpha cells which secrete glucagon. Glucagon is again a hormone which is liberated when you have low blood sugars. When you fall down, hypoglycemia, glucagon gets the sugars up. Then we go to the beta cells which secrete insulin. Now, this is the beta cells which are fired during when you have lack of insulin, okay, which secrete insulin. Insulin is secreted just opposite of glucagon. Glucagon is secreted when the blood sugars are low. So insulin is secreted when your blood sugars are high. Clear? Now, in type 1, the beta cells do not secrete any kind of insulin or very little insulin that the body needs to take external insulin. Now, delta cells, they secrete somatostatin. Now, somatostatin is like the father of insulin as well as glucagon. Glucagon and insulin don't move without their permission of their father, the somatostatin. Clear? So, exocrine is the outside glands of the pancreas. This is the way the pancreas looks. Now, type 1 is usually seen after some infection, maybe an autoimmune disorder, or as I told you, beta cell injury. It's usually seen below 40 years of age. This slide is not very clear, but it was important, so I had to put this. So it's seen less than 40 years of age. Usually, a child is playing in school, young, juvenile, teenager, and he falls. Parents are called and they check, and he's a juvenile diabetic. 8 years, 9 years, it's picked up like this. May have a genetic susceptibility. Beta cell disruption means they are not working. See the language. Here it's disruption. Here it's dysfunction. There is loss of insulin secretion out here in beta cell disruption. Okay. Then we go to type 2 diabetes. It is due to overnutrition. So what word do I always use out of this? So in India, there are lesser people dying due to starvation and more people dying due to obesity or obesity related conditions, metabolic disorders. So people don't die out of starvation. Okay, we die. So instead of malnutrition, we die out of malnutrition. What's the meaning of malnutrition? Is kwashiorkor when the ribs of the child are seen. That is malnutrition. But we die out of malnutrition. What's that? What's
Overeating.
The diet,
in the mall
what you
when
eat
you
in
go?
the mall,
Ah,
all
Junk food, ma'am.
so Neeta
Junk
Dalal,
food.
when you go to the
Junk.
mall, what do you eat? Kailash Parbat ka chola bhatura? How can
No, ma'am. I don't eat anything.
you just do window shopping?
Yes, ma'am.
Must eat,
We have
madam. Life
stopped
is for
eating now.
eating.
We've eaten enough. Now we have stopped eating.
Yes, but you must eat. Okay, so malnutrition. Okay, so then this is usually after 40 years and sedentary lifestyle. Family history, I disagree. Why? Why do I disagree? Come on. Both of you all are there. Mini Gogia is also there. Neeru madam is also there. Why I disagree with hereditary?
genetics loads the gun, but lifestyle triggers it.
Okay, Neeru madam, you also repeat.
And but lifestyle pulls the trigger.
Okay, but both of you all were very soft, so I'll have to repeat again. So genetics loads the gun. Okay, genetics loads the gun, but your lifestyle pulls the trigger. What is the meaning of lifestyle? So in your genes, on your DNA telomeres, what are the telomeres? They're shoelaces. Those genes are there. The cancer genes are also there. The diabetes genes are also there, but they are not saying hello to you. What's the meaning of not saying hello to you? Very latent, very
Not
dormant, chup chap, they're
saturated.
sitting. But if your lifestyle is what?
Good.
The pizzas and the pastas and the burgers and whole day eating, definitely
food,
it
fast
will be
food.
precipitated. So genetics loads the gun, but your lifestyle pulls the trigger. So I may be having a lot, I need to renovate this room. So I get what? I get bricks, I get mortar, I get wood, everything. But I need to call the mason. I need to call the carpenter, then he can do it. Otherwise, if I just get the material and keep it here, it's okay. It's okay. Okay. So we all have those genes, but allowing those genes to manifest, your lifestyle has to be bad. Hereditary, I do not believe in it. So yes, there is one more type of diabetes, type 1, type 2, and gestational diabetes, which is seen in pregnant ladies. But once they deliver the child, they are also prone to be getting diabetes later on in their lives if they do not manage their tongue, their diet. Clear? Okay. Now, let us understand what exactly is diabetes. So if you eat a banana, okay, 17 gram, I told you everything is converted into a carb or a protein or a fat. So 17 grams of carbohydrates are there in a banana. Every kind of carbohydrate is broken down into glucose, and it is glucose which enters your bloodstream. Okay, so this is known as a glucose spike. Okay, now, but if I take a maida, what is maida, Carol? It is processed flour. Okay, refined flour. So if I have a naan or a bread, okay, now that has itself 43 grams of carbs. Again, as the rule goes, the carbs are broken down into glucose, and glucose enters a bloodstream. So in which bloodstream there are more glucose molecules? Obviously the lower one. Okay, obviously the lower one. Now, that does not mean that banana has only carbs. It has sugars. I mean, it has fructose, which is fruit glucose. But comparatively, it has less. So this is what I want to explain to you all, that when a diabetic gets, when a person is diagnosed with diabetes, what you all do is, what do you all do first? To tell me.
People stop
Stop
sweets
eating the sweet
only.
food.
Sweets only.
No, first thing is that they will have fika, chai and coffee. Chai, coffee mein shakkar nahi dalega. Carol, in tea and coffee, they will not put sugar. Okay, diabetes are there. Okay, but you know what they'll do? Bindas, they'll binge on the, what? Dilip sir is smiling. What they'll binge on? Chapatis,
Jeez, chapati.
rice. Huh? Why? Because that is salty, no? All grains are sweet. whether you eat whole grains. What do you mean by whole grains? What is the meaning of
Unpolished. Unpolished.
unpolished? Okay, so you may be having the Shri Dhanya because now Jawar Bajra known as major millets and
Millets.
the minor millets, but also they are in the whole form, but again they are grains. So have you all heard the word GPS? So Dilip sir, what is the full form? Ramesh Puri, what's the full form of GPS? Array global positioning system. I'm not great with I'm not technologically savvy. So in diabetes, you should avoid GPS. What's the meaning of GPS here? हाँ Aparna Kalyanpur. Bina Biyani. Why should we avoid? Tell me, madam. What is GPS? GPS means grains, potatoes, and sugars. लिखो, लिखते हो तो लिखो. Grains में क्या क्या आया? What is there in grains? You're on mute, Dilip.
Maida.
Carbohydrate.
Only maida?
Wheat. No,
Wheat.
Oh, bread.
Rice,
Bread.
wheat, rice, and
Wheat
millets.
rice also, yeah.
So now, haven't you seen that fashion that the cook comes and people have, now there's a fashion of gluten nahi khane ka, wheat nahi khane ka. Okay? So there's a book also which is known as about the Green Revolution, right? How wheat came into being.
Yeah.
Do you know about it?
Yes.
No?
Yes. Yeah. Yes.
Yes, come let me also hear. Tell me.
Yeah, a special kind of seeds were produced to increase the productivity of the wheat. That was Green Revolution.
Okay. A little part. Good attempt. So what happens is that earlier, the farmers, you all don't disagree with the people who tell you that you should not eat wheat, but don't you say that earlier our ancestors used to eat wheat?
Yeah,
They
the
used to drink
seed.
milk. Why they didn't get diabetes?
The
None of you
seed.
all are arguing with me. Arey, my
No.
dati need to eat.
Seed change हो गया है. Seed change हो गया है.
Seed what?
I said the seeds have changed now. Earlier they had different
No,
seeds.
they're
Now
not changed. There was something known as a seed rotation. Seed rotation. So one farmer used to grow, say Dilip sir used to grow ragi. I'm his neighbor. I grow bajra. And Anaita ma'am grows brown top. Okay, just give me a minute. And then what we you do after some time, we exchange. So
Barter
sir, give
system
me a
like.
little bit of ragi. I don't need to grow ragi because he's giving me. So what is this called?
Barter system.
Barter system. This is known as barter system. So I never had the need to grow. Then came the Green Revolution where farmers were given huge sums of money because wheat started getting
Exported.
Okay, and then these little farmers, they were given a lot of fertilizer. Come on. Because the potency of the soil decreases after a crop. But where can we get new fields? Okay, so they were given a lot of fertilizers and then we became a wheat country. And we started having these wheat allergies. So now everybody thinks they're having celiac and they're having, no, not all of us are allergic to gluten. Not all of us. Okay, actually, if you have to see allergies of gluten, the person cannot go to a milling station, a chakki, you can't go. The person will start sneezing. Okay, but what we have to understand is that gluten is a sticky protein, right? It's a sticky protein. And what does it do? It goes and attaches around your viscera. What is your viscera? Your organs. It goes and attaches itself around to your viscera. Also, what it does, something very worst, is that we all have small intestines, right? So small intestines, what happens in the small intestine? Bina Git Biyani. क्या होता है? Function क्या है small intestine का? Absorption. Remember in the beginning of the class, I told you pancreas is placed very close to the small intestine. I think I said it in the morning today. Because absorption, okay, occurs. And what it does, those small holes, it seals them. It's sticky, no? I told you all, maida, what if you stick something here and remove it, your wall will come off. Maida is like that. So this goes and seals those holes if you're on your small intestine. So although you're eating good organic food, absorption is zero. Absorption is zero. You're saying I'm eating good food. Okay. Now what will you do? Suppose you start getting hair fall. You start getting bald. Very sad, no? Very sad that ladies get bald. What they'll do? They go to the trichologist, he'll give them vitamins. Biotin. But again, those vitamins, the holes are blocked of the small intestine. Can the vitamins be absorbed? No. Followed. And why do you think in diabetes the hair is falling? Can anybody give me an answer? Why? Think and tell me. I'll send you all a dairy milk if you give me the right answer.
Can you repeat the question? Sorry, I've been missing a lot of things.
Yes, I Shruti, you're there. Hi.
Hi, but I'm in and out, so I'm missing a few things, but I couldn't understand your question. Can you repeat it?
Okay. So I said, why is there hair fall occurring? Forget diabetes. Forget diabetes. Why is there hair fall occurring?
In general?
In general. Forget diabetes. Because Shruti doesn't have diabetes. She's
I-
a patient of mine.
Use of too many chemicals.
Too many
Chemicals on here.
Lot
chemicals,
minerals,
sodium
I mean,
lauryl
it's like
sulfate,
iron, low iron.
low iron, yes, low biotin, this, that, falana dikda. But
Pancreas are not functioning properly because no absorption from the small intestine.
nahi. You know what happens? Remember, more
Change in the hormone.
okay, hormones, yes. But remember one thing. You know, I don't like to give medicines. Okay? Nor do I take. Even in my fevers, I don't take. My husband pops a Dolo, but I'll rest it out. My body pains like mad. But the next day, I'm up and about. And they're taking Dolo for 3 days, 4 days. Okay, we can't explain family members. So the body, if left by itself, it knows the best what it can do for you. So Lakshmi Madam's body will do best for Lakshmi Madam. Carol's body will do best for Carol. Okay. Now tell me, heart, liver, lungs, kidney, what's important? Heart, liver, lungs, kidney. The nutrients are left. I told you that story. The nutrients are not being absorbed. You have choked small intestine because of the wheat 10 kilos ka dabba which comes in your house. Okay? 10 kilos भरते हैं ना? 8 किलो. No, liver का बाद में बात करेंगे तस्नीम पित्तल वाला.
Kidney.
So the body says, let me maintain whatever this lady is getting little absorption. Let me keep the heart, liver, lungs, kidney healthy. Forget about her hair. It's not important. Forget about her nails. It's not important. Forget about her skin. It's not important. Yes or no? Isn't it beautiful? And what do? Doctor, mera baal, mera hair fall band karo. I want to tell that lady, look, insane woman. It's not your hair. It's your internal gut which is choked up. Can you do something because it's not seen? Yes, you will go and get your hair straightened because the hair cannot talk. Go iron, do ironing on your skin. It will talk, no? Hair cannot talk, so you do everything.
Scream.
Okay? Followed? Why it occurs? So improvise and pay attention to your nutrient absorption. कैसे होगा मत पूछना. Picture अभी बहुत बाकी है. Okay, let's proceed. So this is the healthy way, and this is type 1 diabetes. I'm skipping because again, you all followed it through the other slide. Glucose molecules are going inside. That's your muscle, and this is your glucose. Sorry, that's your liver. So what are the common symptoms? Why I've mentioned them is because I do not want any of you seniors missing out on any kind of symptoms. So dry mouth, slow healing ulcers, blurred vision, which if diabetes is corrected, it comes back to normal. Unexplained fatigue, lot of tiredness, excessive thirst and appetite. We'll understand why, because the cells are always in a state of starvation. Cells ko khana hi nahi milta hai. Because the blood may, all the food is gallivanting like a vagabond of glucose. Nausea, perhaps vomiting, itching in the groin or vagina. Again, very important. Many ladies are diagnosed just by itching in the vagina. Okay. And then they come up with a lot of, in the menses camp, I explain about vaginal hygiene about a lot to you all. We had good conversations. I hope you all remember them. Okay. About the wet bread and the dry bread. Itching in the groin and vagina, increased urination, yeast or monilial infections, unusual or unexplained weight loss or gain. Here, slow healing sores. Now, these are always the symptoms. Always hungry because cells में खाना अंदर जा ही नहीं रहा है. Loss of libido, very poor erections, numbness or tingling of the hands. Again, this happens because there is less of blood supply going to the genitals also. So a person cannot sustain an erection. Sudden weight loss, frequent urination, always thirsty. Okay? Yes. Yeah, weight changes. Yes, the high blood pressure can be accompanied with the, so they are like best friends, diabetes and high blood pressure, but you correct one, others will go. And suppose high blood pressure and diabetes, they are there. You correct one thing and both will go. Tell me. Correct one thing and both will go. What did we start the class with? Array, correct obesity, everything will go. Obesity, no, I taught you how to measure. Okay, let's move further. Now, this is something very, very, very important. Dark skin on the groin, armpits and back of neck. What is the meaning of this? Armpits and back of neck. I do not know whether I have a slide. No, I don't have. That was in another workshop. I had created slides. What do you mean by, so I had this patient when I was around 20 years earlier. She used to come to me for dark armpits and I used to treat her with homeopathy. After I did my diabetic educator program, I realized that dark armpits and dark groins are a sign of insulin resistance. Oh. And she was obese. She was obese. She was very stubby because she was short. Clear? And you realize, as a doctor also, you realize your mistakes. So knowledge is always not power. Sometimes as a mother, it can be very, I have spent sleepless nights when my children were sick, imagining the negatives. Because too much of knowledge is also bad. Okay, ignorance is bliss at times, not always. Another very important line to understand is a black line occurring on your neck. Believe me, diabetes just doesn't come out of yesterday and today. It's there in your body. The insulin resistance is there in your body since 2 years, 3 years, maybe 4 years, maybe 5 years, maybe 10 years. Okay? And when it's full blown, then you experience diabetes. So these things, this takes time. It just does not come as a one-day disease. So this black line is again because the melanin of the body, you know, dark and fair people, the melanin again depends
अगर
on.
ना पहले मेरे को ये भी कराती हूँ बेटे, पहले थोड़ा थोड़ा लर्न
नीरू
कर,
मैडम
फिर
म्यूट
बीच में
करना
जब
ना,
थोड़ा
नीरू
सा वो हो
मैडम,
जाएगा
नीरू
फिर वो
मैडम
रिलैक्स.
म्यूट. So this black
Ma'am,
line,
is dryness and discoloration of legs,
no madam, not that.
shin area.
No,
Is it
not
related to
legs.
diabetes?
Diabetes, this is something which is known as acanthosis nigra. Nigra means black color. So you will think this lady is not having a good bath. She is not scrubbing herself. No. It's a prominent black line coming like this around your neck region, and it will not go how much ever you scrub. That's a precursor or an indicator of diabetes. So you can be seeing it around your people. I told you, no, there was one doctor and one mother got a child. Okay, and she came for sardi khasi, cold coryza, and the doctor, he had this. And he had insulin. These are not warts. These are skin tags because of insulin resistance. So even I'm insulin resistant. But in the diabetics, you'll be having huge ones. So the doctor, he told the mother, "Isko na 20 साल बाद diabetes आने वाली है." And what did the mother do? What did the mother do when he said, after 20 years, your child is going to get diabetes? The doctor told the mother. She came for cold coryza. She changed the doctor. She never went to the doctor again. Who will listen to all this bad news? Abhi to khao piyo mauj karo. People don't like to listen to all this. Pat on your back that you'll have come for this class to understand how to reverse diabetes. Okay. So this is what I wanted to explain to you all. Even dark groins is because this melanin is also dependent on your insulin. Okay, so this is the normal metabolism which occurs in your body. The salivary glands bilateral. So as in my this camp, GIT camp, I explained to you that salivation, the digestion starts with the eyes. If you like the food, you'll eat it. Mouth, esophagus, stomach, and this is the pancreas. Okay, and see, pancreas are very close to the lower end of the stomach and the beginning of the small intestine because it helps in a lot of release of hormones and enzymes for digestion. This is your small intestine. It's small in girth, in lumen, but it's very long. So don't be thinking small intestine. Large intestine, small intestine absorption gets done. Large intestine ascending, this transverse and descending. The water is absorbed and stool formation occurs in your large intestine. Also, your gut bacteria are in your large intestine. That's your appendix and vestigial organ. Clear? Now, this is the way. Okay, let me just ask you all one question. Person has diabetes. Person has diabetes. And he goes for a bariatric surgery. What's a bariatric surgery?
Stomach stapling.
Stomach
Abdominal,
stapling. Exactly like the
stapling.
stomach.
Yeah.
Okay,
Mm.
Mr. Adnan Sani, very common now. Okay.
Yeah.
Now, what happens with us means they create a small stomach, a pouch. There are special staplers, doctor staplers, and then they create a small intestine also from it. Another one. They cut off yours and put again because your stomach becomes so small. So you eat food and you're full. The satiety comes. Right. They suffer a lot from many mal absorption deficiencies also. Very, very important to be managing your deficiencies because little food may you don't get all the nutrition, right? They have to be in touch with their bariatric surgeons. So, heavy person, 120 kilos, bariatric surgery done and diabetes gone. How diabetes gone? They didn't touch the pancreas. Kaisa diabetes gaya?
Less consumption of food.
That means, is it beta cell insufficiency?
Less absorption also, no? Less absorption.
Yeah, but diabetes, they didn't touch the pancreas. If we say diabetes is a disease of pancreas.
Insulin resistance.
Insulin sufficiency.
Hmm?
Insufficient insulin. That won't die.
No, I'm not able to hear you. So is it a disease of the gut or is it the disease of the pancreas? Shocked.
Gut.
Gut.
Okay.
No, pancreas.
Okay. Both are right. Okay.
Interrelated. Interrelated.
Madam, not interrelated, but dependent.
Dependent is the right one. Yes.
It's fully dependent on your gut. Clear? So I'll just take this remaining. I will continue tomorrow, but I'll just introduce you to this. Okay. So this is the cell. How does insulin work? So this is the insulin receptor. If you don't follow what's a receptor, the mouth. Okay. And this is the glucose receptor. So both of these are open or closed? Closed. Okay. The glucose channel is closed. The insulin receptor is closed. Clear? Now, we all know that this, whenever we eat something, the pancreas gets a signal. What signal? That you please release a little bit of insulin.
Glucose.
Okay.
Okay.
Now, what does this insulin do? What is written? Read it loudly, one of you all. Insulin is the key that unlocks the
That
The
channel.
glucose channel.
Okay. So insulin is the key. So Lakshmi Madam's house key will not fit in my house key. And once this is inserted, what happens? The glucose channel opens up. And what is this glucose? Whatever you have eaten, it starts going inside the cell. Glucose channel opens up, it goes inside the cell. Very clear? Anybody? Repetition required? Give me a nod or give me a thumbs up. Newcomers, where are you all? Or you all have left the lecture and gone? They are there. I'm not a bad speaker.
Who's
Following
talking?
Jasmine Siblu? Huh? What you said, Anaita madam?
I didn't say anything. Somebody said, look who's talking. Somebody said.
Look who's talking. That was a
I
good
didn't
one.
say, huh?
Look good. Look who's talking. Okay.
Sorry. Then
So
you
I
are
consider
excellent.
it as a
Compliment.
compliment.
Excellent.
Great. So insulin is the key that unlocks this glucose channel and the glucose goes inside and then you start feeling full. Clear? You start feeling full for the next 2 hours. You don't feel hungry because whatever you've gone has gone inside the cell. Okay. So this is it. Food, how insulin works. Diabetes means your blood glucose level is higher than normal. Okay. Now, food we eat everything is converted into glucose and enters our bloodstream. The blood glucose, believe me, the blood glucose levels go up. Huh? Now, insulin is the hormone which is made by who? The pancreas, the beta cells, acts like a key to unblock the body cells and let in glucose. Simple. Okay. Now, glucose leaves the bloodstream, means from the blood, it has gone shoved inside the cells. The blood glucose again becomes normal. Okay. So the blood glucose becomes normal. The cells turn into glucose, into energy, and this guy is nice and energetic. Right? He is energetic. Simple. This happens in a normal person. Let's understand more. Okay, I skipped this. It's a little complex about glucagon and all. This also I skipped. Okay, this is something akin to the earlier slide. Food goes into the pancreas. Pancreas tells you insulin is released, picked up by the body cells. See, this guy is running. He's energetic. And little bit of glucose is energy saved. Okay. For later on. What if I don't get food later on? And this energy fuels the body so that I am energetic. Are you all with me on the same page? Making sense? Yes, no, perhaps.
Yes.
Yes.
So in case, I do not believe in these, but in case you all want a picture, because everybody has individual readings and some are happy with the higher reading, some very little fluctuation, they'll create the whole, take the whole head on the house on the head. These, if you all want, you can, and these keep changing with the Lancet and with the American board. Every minute they change the HbA1c levels. So nothing to be dependent on. Okay. Now eat food, glucose, food goes into this thing. Cells take this is the insulin resistant cell. Okay. Pancreas secrete insulin and see this, the sugar is remaining out only here. not being able to go inside, okay, you'll end up calling one more burger. You've eaten the burger. Again, you'll end up calling more burger. You're always hungry. Okay, because the blood glucose is, the sugar is only gallivanting in the blood. It's not taken in by the cells. Again, the insulin is called upon further. So I don't want to rush with this. I'll take this in detail again tomorrow. So this is insulin is the key. Okay, the key is gone. The glucose channel opens up and the food goes inside. Okay. One more slide for the same. Insulin is the key. The door opens up. The glucose goes inside the cell. Clear? This happens in everybody who is non-diabetic. I eat a cashew, little bit of insulin is released. Even in a little bit of cashew, the key, insulin is the key, opens up the cell, blood sugar goes inside. Okay. So insulin works like a key. See this? What is happening here? This is something known as insulin resistance. Okay, I'll take this part again tomorrow in detail. And what is this? What is this? The sugar is outside only, not able to go inside. Okay, what is this?
It is blood. It's not
blood.
opening.
This is not blood. So tomorrow I will be telling you about this slide, which is there, you know, in Tokyo, there are people employed to push you into the train. Okay, in Tokyo. So this slide we will speak tomorrow, and we will speak in detail about this. So there's a naughty boy. What you all use? Okay, I'll take it in detail tomorrow about the naughty boy and the chewing gum. I don't want to hurry. I want to tell you all what we used to do in the afternoons when everybody used to sleep. I never slept. Okay, we used to ring the bell and run away. Something else also some people used to do, boys used to do. I'll tell you all everything tomorrow. We are at 4:01 and I'll have to end the class today, but I'll tell you this story tomorrow, 3 p.m. sharp. We'll get started. We won't repeat whatever we've done today. Lot to tell you all. So thank you for the gift of your time, energy, and attention. And thank you, Anurag, for being there with us always. We meet tomorrow at 3 baje.
Thank you, ma'am.
Thank you, ma'am. Thank you all. Bye,
Thank you
ma'am.
for a
Bye.
wonderful session.
Thank you, Dr. Divya.
Bye, ma'am. Bye, bye, bye.
Thank you, ma'am.